So you're telling me that people who are using multiple hair color, hair product, everything?
Hair color, room freshener sprays. We reported a case of beard growth product causing lichen planus pigmentosus.
If let's say a 25-year-old wants to get to the Korean glass skin,
The 10-step Korean routine is a waste of time.
if somebody looks at like this product is hypoallergenic, all this or like red flags to stay away from, or is it okay to buy?
If something is hypoallergenic, it means
Sunscreen in our race is not for prevention of cancer much. It's only to prevent the tanning and pigmentation.
tanning is everybody tans. That much we can accept to a certain extent. People who do not like tanning, I generally say, okay, you can use a sunscreen because it's going to protect you.
You know, some influencers are doing it without their knowledge. They used it, they look good. The influencer think that, okay, so this is a product that I used, I looked good, so I am recommending to my clients. Right? What do you think will be the impact of all this on our patient population?
I think one group is fairly...
In your patient profile, have somebody has come to you and then said that, okay, I need to do plastic surgery to look like Samantha or something like that?
happens. Sometimes it may be that we walk away.
Hello guys, this is Dr. Pal Manikam. Welcome to another episode of our podcast series, Gut Feeling with Dr. Pal. I'm really excited about this episode because we have our friend, Dr. Renita, a celebrity dermatologist here in Chennai. She's absolutely amazing in terms of her scientific evidence-based treatment for her patients. I have seen her personally treating her patients, and I really thought that having her in the show will clear most of the myths that we are dealing surrounding skincare. So in this podcast, if you are somebody who are looking for how to take care of your skin, if you're somebody who are looking for what sunscreen to buy, how to buy, how do you get a good ingredient in a product, how do you analyze whether this product is good or not, what are all the natural remedies for skin treatment that we have been told in the past which is not true now, how does a celebrity take care of her skin or his skin. We talked about different celebrity skincare routine as well, and more importantly, what is the importance of gut skin access. This is a wonderful power packed episode with information. I'm sure you'll enjoy it. Let's dive deep into it. Hi, Dr. Renita Rajan, the most popular dermatologist in Chennai.
Nice to meet you, Dr. Pal.
Thank you for your time, and we are very happy to have you here. And we just thought that, okay, we'll have a candid conversation in terms of general in skincare and skin trend with you. And you have proved yourself as a pretty well-known person in this field with lots of research-backed evidence, and also your practice has been beautiful, where I have seen my patients get treated very well under your care. So as a dermatologist, I'm not sure whether somebody's asked this question to you. What is beauty?
Very good question, and this question is commonly discussed in our conferences.
Is it right?
Yeah. So the concept of beauty has been changing, that we know. But what is the latest aspect of latest definition of beauty is we've moved away from symmetry to what is called as the hero feature. So each of us initially were thought that the most symmetrical people were the most beautiful people. So all
Symmetrical
of our,
means equal
exactly
on both
the
sides.
same on both sides. The right left part exactly the same. We thought about the golden ratio, that everything has to be in that 5 ratio. So the golden ratio is basically where 1:1.6 is the ratio that the distance between the eyebrows has to be, the distance, the proportion of the nose to the mouth. So this is typically the ratio that we thought the golden triangle, or most architectural buildings utilize this. It's naturally present in the plant. It is naturally present in the sunflower. The sunflower follows a golden ratio between the distance between the petals. So when we see this golden ratio, it's also there in the Milky Way. It's like a universal proportion, which
Milky Way galaxy?
the galaxy. It's there in many things around us. Most nature has this. So typically this golden ratio is something where people are more symmetrical, and we were trying to, either by procedural treatments or however, we're just trying to say that the most symmetrical people are the most beautiful people. But in recent times, what has emerged is that we see familiarity. We see relatability. Beauty is when I understand you. This probably is a change from the earlier the ice maiden, perfect sculpted face kind of beauty, to where it has come up to be where there is something about you that in my brain says that we are similar. culturally, ethnically. I just want to know that, there is some connect between us. Like how we meet people from our childhood, school days, same town, and we hit it off instantly, the Ur sentiment and all of that.
Correct.
Something in the brain is also responding to the facial aspects. And we can judge somebody only in a matter of 6 seconds.
I see.
So you will maybe see 2 features. For example, I would typically look at the eyebrows in here and say, okay, here is somebody that's, expressing in a particular way. And that communicates to my brain. And therefore, over a period of time, it softens to be like you're like me. And therefore, I like you more. So it's become 1 or 2 hero features that are likable. As compared to what we were doing 10 years ago, saying like, you have to have this proportion, you have to have that golden ratio, the phi ratio. Now it is more about pick that person's hero features and don't alter it.
Alter it.
That is why people like them. That is why they like themselves. So if you alter that a lot, it becomes alien, and that's when it becomes a concept away from beauty, where we are trying to fit into standards, and that's the newer trend right now.
In the US, if I see a guy from Madurai, I feel really happy. Right? We can instant connect.
You don't feel happy when you see somebody from Trichy?
No, local town, as you said.
Of course.
Right? No, of course, any Tamil Nadu, any Indian, we get that connection right away.
Yeah.
Is that isn't one normal angle that we have been talking about a lot in our conferences as well.
Yeah.
But practically speaking, you are a celebrity dermatologist, right? Everybody who was on social media or in the film, do they come to you, they understand this beauty, or they want something different?
2 parts. Luckily, we've been able to attract people who understand this to a certain extent. And the other part is also that when you're starting out, there is a lot of pressure to be something. As much as you're more in a vulnerable state where maybe you're just starting out in movies, and then everybody on the street and their cousin gives you their opinion. So there's a vulnerable group of people that will be like, okay, I want so many things changed about myself. And then and then there's a mature crowd who are like, I just want to give a little bit of a difference each time. So that's the homework that they are putting in to appear more closer to the character that they are playing. Like, I want to look a particular way. Even to these people, I actually suggest that, don't finish all your changes now. Just add one change as you go, so that it looks like you're creating a difference for the audience every single time. And my job is to make it look subtle so that it doesn't look like you've done too much on yourself. And in all of these cases, we don't touch the hero feature.
Even in a heroine?
Of course. Of course. Sorry, it hit a little late. Of course. Maybe we should call it the heroine feature.
So there are hero features in a heroine, in a person who you don't want to change.
Yes, that we shouldn't ideally change, because then you kind of take away the essence of what they are. And the idea is to be able to identify that particular feature and keep building on it. Sometimes it could be as simple as the jawline, because for us Asians, the jawline is something that if it looks too big on screen, then people start looking a little mature. That's typically the most common treatment or the most common area that people want to work on. Compared to the West, where everybody wants filled cheeks, here it is mostly like the face needs to look small on screen is a common requirement, that they feel, okay, here is somebody that needs to look or fit in the frame well. Then that's a most common area that we are asked to work on, or we work on. And it is also it is also some place that shows visible results. So then that's a SOP that most people end up using.
So the jawline will be lower a little bit.
The jawline will be more contoured. Because then on screen, because they will, in different emotions, they will have to look down, look up. The lights will be set accordingly. And people don't want to look bulky in here, because in any of these scenarios, you really want the eyes to speak. Usually those are the ethos part of the movie. So then the eyes should speak. They should not kind of overpower it. So you basically play to the proportions of what's required for that emotion.
Is it like a surgical procedure, or?
No, we mostly, as a dermatologist, mostly non-surgical procedures. But surgical procedure, opting for a surgical procedure is very low in our population. We usually like a lot of natural beauty in general. So we use mostly non-invasive procedures or minimally invasive ones, mostly about lifting, tightening, contouring, not so much like a
Lifting means you're lifting the skin.
We use radio frequency procedures. Then they can be micro needling radio frequency procedures that basically lifts the skin and subcute to some extent. More invasive procedures like threads are also not commonly preferred here. People do them, but we don't have that kind of a South Indian face that requires a lot of work. And also because there are two types of aging. One is called the atrophic aging, which you see in Caucasians. For skin of color and for our type, you usually see the hypertrophic aging, where we become full. As we grow older, typically this part becomes full. Women start seeing this in late 20s, early 30s, depending upon how they've let go or maintained. This is typically the time that it comes in. So this area is a most commonly worked on area in general.
Area. So, in your experience, celebrity, I mean, you have had different levels of celebrity at their stage of fame. So, have you seen like a person coming in initially with all these requirements? Have their requirements gone down when they have established themselves?
Yes.
Like, for example, Nayanthara has established herself. But how about the new dragon heroine who just came? So in her progress, the expectations have gone down.
I think there are also people that have learned to reinvent themselves, and skincare or what they have done for themselves is just a part of it. So for some of them, it may be the way that they play up a particular part of their makeup. For example, it could be like working on strong eyebrows, for example, or working on a specific feature like the jaw that we spoke about, for example. These all could be the way that they constantly reinvent. The more established people in the field, because of their experience and because they exactly know which light wear will give them what, they have a very good knowledge of how to present which side of the face. Because of all of that, their requirements are very less. They know. But for the younger person, and nobody will walk up to somebody senior and actually tell them, "Madam, this is looking off." that person will be off. So nobody's going to go and play on their insecurities. But if they hardly have that many insecurities at that level. But for the younger people, everything is an input. You do not know where their next opportunity is likely to come from. So they get a lot of feedback, lot of noise. So then, and in them, the idea is like, I usually say, this is not the only project. You're going to get a whole lot of projects. And then typically we work as a team at Render. So between typically Dr. Subhashini and I, we just say like, okay, here is how she's going to go down the journey. And here are the areas that we can help. And we observe at each level. So over a period of time, we've learned that it is really important to be very conservative.
I see.
Because the expectation keeps
changing. Wow, it's very complicated.
Yeah.
Right? Decision making is really not easy.
Yeah.
It's not like an algorithm. You yes, do this, no, nothing like that.
Yeah. Sometimes you will be able to, if it is a similar face, then we say that, okay, maybe this is the thing, this is the SOP that has worked for us, and then maybe you want to get onto this at this level. And sometimes if it is a very exotic face, I usually say, what do you even need us for? And you're happy to take the credit for your genes. But we sometimes really don't have a lot of work at all. Sometimes I just tell them that
this is enough.
This is good enough. You need a better photographer for your portfolio. Yeah.
In your patient profile, have somebody has come to you and then said that, okay, I need to do plastic surgery to look like Samantha or something like that?
Happens in a few cases. That's the idea. You look at the body dysmorphic disorder scale. Do you think like is this person really aware of what they are asking for? Sometimes it may be that we walk away. We reserve the option to say, okay, cannot work on somebody with an expectation that we can't match. While we respect their journey, it may not be in our hands to really deliver what they want. I usually am totally okay to give second opinions, go meet somebody else that may work out.
But how common is that?
It's become very rare.
Very rare.
It's become extremely rare, and for that, I think it's social media in a way, especially the kind of posts that go viral. If you look at it and the people in it, we have representation of everybody. That's the beauty of social media. As much as I think much of the mental health loss is attributable to social media, I also see that everybody is represented almost evenly across the world. In a matter of 5 years, you no longer have somebody as so-and-so's videos are going viral because they look a certain way. It's become more about the content and how they learn to engage with people. So then this beauty standards have become quite different. So now I no longer see that I have to look like ABC to become somebody.
I see.
I see that it's
That
become
trend had
very
changed.
diluted in a good way.
But this was the norm before.
It was very much, we used to get photographs saying like, I want this nose, I want this face, and so on. It's hardly
That's
ever.
diminished.
And post COVID itself, I think we've kind of gotten that no, so many things can go wrong, but we're still okay. I think that's
Nice.
tempered people a lot.
Nice. As a dermatologist, do you think skin is a good health indicator overall?
It plays a huge role in terms of how your internal health is, and it also plays a huge role in terms of what you're projecting to somebody. I think both are equally important. So you want to be able to, the skin to reflect the kind of health goals that you have, the longevity goals that you have, and you also want the skin to speak for you. So the idea is that we want the skin to work for us also to be projecting a particular ethos about ourselves, a particular personality about ourselves, and that this foundation of that gets laid in the health. So I see this as a way of using your health, using skin as an interface to demonstrate that you are healthy, young, cognitively well, and therefore of value to others as well.
I'm going to argue in a different way, where people are actually really concerned about how they look.
Yeah.
I don't think at least the percentage of people really putting the effort to get their health well is much lower. Is that you see in your practice?
Let me see if I understood it right. So what you're saying is people put more effort into how they look versus the health that is required to make them
look the way that they want to.
It is definitely a disparity. People think that this is the easier part, this is the cheat sheet.
Correct.
But the truth is this is what works. Especially if you see somebody, maybe because I'm in my mid-40s, I feel that this is more important to me. But maybe at a younger age, people feel like there are certain things they can take for granted and maybe project a particular thing. But as we are going down the line, and I mean, as I am going down my years, I feel that this part where you are holistically able to project what you are internally are all the way to who you want to be seen as, I think the proportion of people, maybe in my age group, or maybe because I hang out with people in the 40s, I don't know. So in here, I feel that is the changing mindset right now. I still see the teens and maybe the early 20s, I feel that they are super vulnerable. But I think as you come towards 30s, and especially Indian women look their best in their early 30s. It's not the 20s. We look our best in typically the early 30s, and we are hoping to pull that out into 40s and 50s.
Why is that?
I feel there is a lot about the facial structure itself. For example, if you observe somebody from their early 20s to their early 30s, you see that the tear trough actually changes. There's still that skeletal shape that's changing. And why I said early 30s is when mid 30s you start seeing the jawline. Till that time, and if somebody's not let go of their weight, not let go of their health, and they've not put on or yo-yoed in terms of weight, I feel that the early 30s is where the face looks the most correct for that particular skull proportions and stuff. And by then, by 30s, people have also figured out what looks good on them. They've also figured out their hero feature. They've also grown comfortable with how they look. So that's typically it. In 40s, if somebody walks up to us and tells us that, you look off, and you'll tell them off right away. So 30s is a nice place where people actually start getting more compliments for how they look. And there's also the bit of, maybe earning potential is also comfortable. They've worked out the insecurities of the 20s in terms of marriage or settling or career. I think that's a very nice place that people should enjoy. Add a little bit of workouts, physical fitness over there to totally enjoy.
I want to ask you, if you want to add fitness, what do you think in your practice, at what age you will recommend?
We start from anybody, everybody. Strength training is a standard recommendation. At any consultation, strength training is a standard recommendation.
So strength training improves the skin changes?
A lot. A lot. Insulin resistance is our biggest enemy. Even for acne, for hair loss, for facial hair growth, for body type, or also for people also want, if you're working out, you also want to look aesthetic. You're really working out hard in the gym. You also want to look a particular way. You carry the stress, and the posture changes, the comfort of yourself with your body changes. So all of that is very important for a holistic health. Holistic. We call it youthful longevity.
Youthful longevity, yeah.
So the recommendation goes very early. My kid is 10 years old in strength training. And yes, she goes out to fitness and stuff. I think most of her classmates are on it. I see most children, the pre-teens, I think it's becoming a very
A good thing.
good trend,
Good
actually.
trend.
Yeah.
Good trend. But when you say to your patient that you need strength training, what is their first response in commonly?
Compared to 10 years ago or even before COVID to now, we recently did a survey of how many people are already on workouts. A healthy 30 to 40%, which is almost, it was 10%, less than 10% earlier. Now 30 to 40% are already on a workout routine. So I think it's
changing.
it's changing.
It's
Another
changing.
2-3 years more, I think all of us will know that this is the way to do.
Right,
This is the way
right,
to
right.
be. Yeah.
I think I'm going to speak behalf of you, where people think that dermatology is just a skin beauty and everything. I do think that you see a lot of people with mental health issues. Correct? How do they present to you? Will they be so obsessed about it, or do you think that the skin health is a reflection of the mental health?
Let me look at 3 groups of people. Now, the younger people, unfortunately, we still have one other generation that's still talking about skin tone or still doing a whole lot of, I wouldn't call it body shaming. I mean, for that matter, if somebody has to work on their body, then we talk about that. We are obliged to, or we are expected to talk about that. But then sometimes if it's coming in from parents or relatives or friends, it may not land the way you and I counsel them. It lands in a harsh way. This doesn't look good on you. So that group of people is like, that group of people comes up with, okay, people say that something's not good about me, and therefore I must fix it. Then the largest middle group, which is basically if you have acne, these people also have pain associated with it. It really is difficult for me to go through my life expecting to achieve all that I'm supposed to achieve and also bear with the pain. That's like the largest group. So they have a problem solved. Then the third group is who want to signal something with their appearance. Like I need to be, it could be very central to their work to look a particular way, or it could also be that that's how they see themselves. Either it's an internal signal or you want to signal it out for opportunities or just for the whole. Sometimes it could also be about appreciation. Like this is who I am in society. That group also, there's a bit of insecurity in some of them in as much as appearance is important for their work. There's a bit there. But it's also another group who are like, I want to age gracefully because this is who I am. I will put my effort into work because this is who I am. So in this group, yes, some insecurities, but not so much like a mental health issue. This group is very factual. The younger group who have still not figured themselves out. There's a bit of plus minus. I also still feel that bridegroom ka insecurity, that's very much there.
Have people come to you and then said that I'm getting married in 6 months?
Often.
Make me look better. Huh?
Yeah. That is quite. They would also, now we are also talking about how soon do you have to start your, prep for your for getting married. How soon are you likely to? Those are you'll find n number of blogs on Google. And there are a bunch of brides who want to say, like, I don't want makeup, I want a natural look, and I just want my skin to look healthy. So this proportion is also coming up. People are, now I think, there's a group that wants to do the big fat wedding, but there's also a group that understands that the wedding is only the beginning of the marriage. Then here they are more experiential. They want to have like a very nice event.
What do you recommend to them when they come and then they say, for the big day, please get me ready?
Usually we look at the problem space. If they have a problem that we want to fix, then we fix that. Or otherwise, I look at the signaling. So maybe for a wedding photography, typically you want to have the jawline contour, maybe like a non-surgical radio frequency skin tightening, because that will capture their angle very well.
I see.
So maybe that's what they want to do. And sometimes it will be about skin quality because they will want to use makeup and they want a certain luminosity. So it may be about hydration. Sometimes it's as simple as that. But if they have a problem that they want to fix, so small skin tags that need to be removed so the skin looks better. So now we are thinking about what do you signal on that day? What makes it easier for you? Otherwise, when they use a lot of cover-up, by the end of the day, all of that starts to look very patchy on photographs. So now it's about photographs. So we look at what will make these photographs come out well. So we just try to solve that small bit of the day for them. That's about it.
So next segment is we're going to talk about skincare products. Okay, I want to ask you, how do we choose the right skincare product? Okay, because you're an entrepreneur by yourself. Is there any harmful ingredient that a person should look at and then they say, okay, I'll stay away from this?
So rule of thumb, if you have products that are rinsed off versus something that is left on. So rinsed off products, you can have a very low threshold for what's in the product. You need
Rinsed off means you wash out.
like a face wash, like a
wash.
shampoo, stuff that's washed off.
I see.
So then that comes in contact with you for a very short period of time. So there is not a lot of absorption issue. You need to be mindful of what you're putting out into the planet. That part is there. That part, I think there is a lot that's being discovered in what we call as the exposome aspect. What are all the things that we are exposed to? That's still work in progress. But we have early signals saying that the less you put out, the better.
Okay.
That much we know, but exact composition of what's terrible is still to be
Research
set. I think, as Indians at India, we are the receiving end of a whole lot of dumping, much like other Asian countries. So we need to understand: are we getting more of the stuff that goes out? That's the rinse-off aspect. Then the leave-on is something that we need to be super careful about. Typically, the most commonly left-on product happens to be sunscreen or makeup. In people who have been using makeup for a very long period of time, that is something that has been associated with, actual absorption. For example, we know so much about sunscreens because it came to protect us from the sun exposure. And then it ended up, we are now working on what gets absorbed. It ended up being an exposome in itself, saying like who should not be exposed and so on. Even examples like, between rinse off and leave on, we think hair dye is you apply and rinse off. But whatever the product that is kept back can still react with the skin immunologically to create long-lasting pigmentation, long-term pigmentation. So we need to understand how much are we constantly being exposed, and that will decide how safe it is for us. And these are also cumulative.
So it's, in general, it is better to use the rinse-off products if compared to leave-on.
Maybe rinse-off products, you can be a little casual. Leave-on products you have to be, because you really can't. Your sunscreen has to be left on. Your face wash has to be rinsed off. So I don't think you can choose either or. But then here you can be a little
lenient.
Whatever the face wash is, it's not that terrible for me at this point. But whatever your leave-on products, they will cumulatively make an impact on you. So you need to be careful. A moisturizer will only work when it's left on. We can have a moisturizing body wash, but this is going to be way more effective. So you need to be careful about choosing. If you have limited attention, then invest it in the leave-on products for you to research a little bit more.
So let's say we have a leave-on product and the ingredients like parabens, phthalates, formaldehyde, all these are okay? Yes, no?
So for leave-on products that which comes in contact, I would say no to parabens completely. The reason being that we have enough data at this point to say that there is a human health impact. Earlier, we used to say it's primarily like, ecosystem, or they used to use very high doses in animal studies. So we say like that's not really applicable to humans. We'll say that the minimum adverse, the NOAEL, is not that high, so it's not relevant for human use. But now what we're saying is that it's so much human population sending so much out into the planet, and all of this coming back to us in various ways. I would say stuff like parabens and phthalates, completely off.
So there is evidence to do that?
Yes, there is evidence at this point to do that. We're recently trying to put up a group, the endocrine disruption consensus group from people in the fraternity, and also oncology, endocrinology, gynecology, infertility, trying to put everything together to start consensus guidelines. And the first one we chose was paraben.
Is that right?
And the second one is phthalate.
Wow.
Yeah. So that had the maximum evidence. So we said let's start from here and then go further. It's a work in progress. We expect to get done to some level. Maybe
it's a huge work. So when you say endocrine disruptor, I'm just going to put that in simple terms for the audience. So you're basically saying that phthalates and formaldehyde and parabens and phthalates have some evidence which could potentially influence your hormonal secretions.
Of course. It could influence they could also react with our own receptors, and the signals that come forth may be not favorable to the human body. They are capable of binding with the same receptors as our hormones do, and then they may create alternate signals. For example, a recent study came up saying that if you quit these endocrine disrupting chemicals for a month, then the breast tissue, they studied the breast tissue, they found that it went back. The negative signals came down. I'm just simplifying it a lot, but whatever signals that were accrued because of exposure to phthalates and parabens, in 1 month of not using products containing these, it showed that this was lesser.
So people are using phthalates and parabens. If they stop using it within a month, the effect can be discontinued.
Yeah.
So is there any beneficial ingredient that you can see? Okay, so let's say, for example, this cream has hyaluronic acid. Is that a good thing to buy?
There are a number of nice ingredients. For example, I really like hyaluronic acid, salicylic acid. Salicylic acid, now unfortunately getting into the endocrine disruption mode when it is left on. It's a great ingredient to use as a rinse off. We use it in chemical peels in dermatology all the time. It works so well for our skin type. Very safe peel. And then if you look at something like hyaluronic acid, it works very well for increasing skin's hydration. But hyaluronic acid, somebody might appreciate it better in maybe Kashmir or Bangalore, where the humidity is less compared to Chennai, because the humidity here makes sure that our barrier gets repaired every so often. So the impact of the same molecule is quite different. So then you have lactic acid is also a great humectant. I really like it. I also like tranexamic acid. We like it in dermatology a lot. I know it came from gynec.
Yes.
But we like it in dermatology a lot because in any form, IV, oral, topical, we use it post microneedling, post laser. In any form, it has a very beneficial effect on pigmentation. When it came out in terms of how gynecs used it IV, and we use it prior to procedures like hair transplantation. We use it prior to certain procedures where acne scar procedures where there is a lot of oozing, bleeding expected. That helps control that. But in addition, for conditions like melasma, very difficult to treat if you live in a high UV index country. So all of that tranexamic acid is a very rich molecule. I also like antioxidants like pycnogenol in any form, oral topical application. It's a polyphenol. It's a super antioxidant, and I also think that these agents have a much better chance of surviving oxidation compared to vitamin C, which gets oxidized very fast. So very difficult to put into a product because it gets oxidized very fast. We may not, retinol is great. It trends on and off. We may not have the same needs like the Western population. Our needs are simple. We don't want to get pigmented. That's about it. Because we don't age much. Outside of pigmentation, our aging is very minimal.
You talked about pigmentation. Do hair dyes cause cancer?
A lot. So in 2004 to 7, during my post-graduation, I inherited 3 to 4 cases of lichen planus pigmentosus from my seniors, and I gave it to my juniors and came. In 3 years, we could just manage them. Just 4 cases in my entire residency period. Now for every consultation day, it's at least 3 to 4 cases. It's increasing very rapidly.
Lichen planus.
Lichen planus pigmentosus. It's a variant of lichen planus where where our immunity misbehaves and targets our own skin.
So your body thinks that your skin doesn't belong to you and starts eating up your skin.
Starts creating problems in the basal layer, and there is what we call as an interface dermatitis, where pigment that is to be kept above the basal layer gets into the upper dermis.
So you're saying the frequent usage of hair dye can cause pigmentation in the scalp?
No, it can happen all over the body because we have certain areas that are hot targets, typically the sides of the face. Areas around, there are areas on the face, it can go on to the neck.
I see.
We are, unfortunately, we have these hot beds that can become easily pigmented. So if it is on the scalp, it becomes not very noticeable. It's kind of okay. It's
Will ammonia-free help?
Not so much. It's not about ammonia. Ammonia is more about the cytotoxic risk. But this usually when you see hair dyes containing para-phenylenediamine, which is something that can trigger. But there are a lot of other such chemicals that can trigger, which are in our perfumes, which are in our room sprays, car seat, the polishes. There are a whole lot of chemicals that can trigger this for the cells to misbehave and start putting in more pigmentation in the upper layers of the dermis, from where it kind of becomes trapped and is not able to get shed off that easily. In the epidermis, it sheds periodically. In here, it gets trapped. There is a actual damage to the dermal epidermal interface.
The skin layers.
Yes. That happens.
I read reports on hair dye causing renal and bladder cancer. Is that true?
That's the oxalate component. The renal failure part is the oxalate component that was also in news last year. But there are a whole lot of azo dyes. We've read about that in community health, where these specific chemical compounds, but most commonly present in coloring agents, colorants, can actually create aniline, azo. All of these can have a carcinogenic
Is there some
effect.
evidence to it?
There is some evidence. In fact, there's a very nice study called the sister study. This is sisters of those who had CA breast were followed up for decades. And then they found out who are at risk of developing it themselves. So they found that people who had more than 4 times use of hair straightening, hair treatment products had a higher risk. So it is in this cohort. It's like a very tight cohort, and it's been followed up for, more than 10-15 years, more than 10-15 years. So then they were able to identify that there is a finite amount of hits that we can take, and then any coloring versus never colored or never did hair treatments, they found that was more protective for them. When you pit this against quality of life of people who are asked to stop coloring, especially when they have premature graying, it becomes very difficult to tell them about that long-term problem as compared to this. So it's the same with exposomes like smoking. Earlier, it used to be so difficult to tell people, like, don't smoke, you will end up in cancer.
Right.
Now you will get aging now. You will get skin issues now. So then people are able to see that.
So hair dye, there is a slight risk. But how frequent is there any cumulative exposure you could use, like once a month?
I usually say no more than 4 times in a year.
4 times in a year?
I usually say that because putting together multiple.
I think this will work only for Ajit Kumar for salt and pepper. 4 times a year, so once in 3 months. Yeah. That's a good recommendation.
Yeah. Any hair straightening, smoothing, I say just, it cannot be, you cannot do clean chemicals in hair care. It is difficult.
It's not.
It is very difficult. You cannot completely eliminate silicons. It is very difficult to do clean chemicals in hair care. So we try our best to say limit as much as possible. Skin, of course, you can do you can completely move everything to clean chemistry based on whatever data we have. It's possible. But hair, it's about a matter of doing less as less as possible.
Do you do patch testing and do you recommend to patients?
Yes.
And can you tell my audience what is patch testing?
So basically, it's a battery of chemicals that have been notoriously implicated in the past. So notorious has to be significant. So because the number of chemicals that we can put on or test is limited. So these have to be the most commonly reported allergens out there. We have less Indian data. We're currently working on a project that will bring more chemicals of Indian context into our own patch test, which is more relevant to us.
So we'll tell the audience what is patch test. Patch test is a test that you apply on your skin to determine whether you're allergic
to a particular ingredient
in the skincare product.
In the skincare product, yes.
Is that recommended for everybody?
Not really. So the amount of allergies that we have per se are fairly less compared to the Western population. But what we are learning of late is that we become more sensitized. So in patch test, there is one other refinement called photo patch test, where you basically look at allergy from the ingredient, but you're also seeing how much of it is potentiated by the sun. So that is a little more larger exercise, and we are currently trying to find out how to make it more applicable to everybody. But it's not something that we recommend. If you have a problem, like somebody comes in and says they have and we've diagnosed biopsy, dermoscopy, and we say this is potentially a pigment contact dermatitis or a hair dye allergy. In those people, when we check, or in melasma when we check, there are these sensitizers that are part of the problem. So then we definitely see that. We see a lot of it could be controversial, but we see a lot of reactivity to the preservatives used in vaccines. Thimerosal. We see that a bit.
Did you get that after the COVID thing?
We do not know. We only started testing much more commonly, and we also had a lot of COVID-induced skin changes, pigmentary changes. We had a lot of skin changes during COVID, and some of them have actually had that problem from then. So post-viral is also one of the causes of this lichen planus pigmentosus. Right now this exposome science is, we hope that over a period of time, the more data that we keep feeding, it will give us more information as to what is the weightage to each of these. Is post-viral a bigger component, or is it is the hair dye actually
Actually a
the
problem.
main culprit, or is it in a particular person? So
I see.
yeah,
It's going to be very individualized.
yes.
But in general, can you say that if a patient has an allergic response to anything else, before using a skincare product, it's better to do a patch test?
Yeah. So this is the patch test that you can do with the product. We call this the as-is patch test. So in general, for example, the hair removal creams, generally they will ask us to patch test. That's been there from several decades now. They usually ask you to do it on a small area and patch test. But it's sometimes difficult to identify if you will get a pigmentation from it. For example, you buy an eyeliner, you could patch test it, it and use it. It will not give you that irritation or that allergy. But would you develop a pigmentation from this? Can't be identified because it's a cumulative insult. Or you
So
typically
patch test anybody can do by themselves.
before any product use you can test. That's
Before any product, they could just apply on the forearm.
on the forearm or behind the ear.
Behind the ear, and
the
then
ear
monitor for 24 hours?
24 hours and the next day and have a look at that. But this will only catch if you're really like you have like a contact dermatitis which is itchy, product not feeling comfortable, which you will know. This pigmentation is not something you can pick up. You'll slowly start being able to identify, okay, so and so uses hair color. You'll start seeing that C-shaped pigmentation slowly. After a point in time, you will notice this, and you will also notice that you may see their roots, but you'll also notice that C-shaped pigmentation is becoming much more common. And these are individuals who have had flawless skin, so for them this condition is it's
They
so
can't
painful
take
to
it.
manage. Yeah.
Wow. What does non-comedogenic mean?
Okay. All right.
I did my
It simply
homework.
means that this product is not likely to give you pimples or clog your pores. That's the basic thing. Like coconut oil is comedogenic. Olive oil is comedogenic. That said, if something is very oily and you are going out to the beach and it's very humid, even if it is not like a truly comedogenic product, it will still give you a bit of clogging.
So coconut oil can clog your pores.
Yes, coconut oil can clog and can cause acne. And sometimes when you stop, people think that they have to do 10 things to get rid of acne. So sometimes you just stop a few things. It works much better. You can actually see like within 2-3 weeks, somebody who's predominantly developing pimples from applying too much coconut oil, overnight coconut oil application, it'll just settle. And that's all the intervention you need at times.
But do we apply coconut oil to the hair, right?
Not anymore.
Not anymore?
Not after you left abroad.
I went to Madurai last week. My mom asked me to do
Your mom is a different story. Same blood. Mom is a different story.
But what does coconut oil do to hair?
That was the only grooming aid we had because we do have a certain amount of frizziness in our ethnicity, and we're also in one humid place. So more or less south of India, it's fairly humid, tropical, we're 10 degrees north. So for us, we needed some agent to groom. Until such time that nothing else was available. Silicons are a new concept. Until such time, silicones are a new concept. Until such time that it was available, the only affordable product which did not smell too bad was coconut oil. And if you also see in our maybe about 150 years ago, coconut oil was specifically a product that some of us could afford. When they scold us also, why are you not applying coconut oil? Do you not have, are you somebody on the streets that can't afford? So they usually tell that because it was also a social construct that I could afford to use this particular agent to groom myself. And over a period of time, it became that when you see, for example, they'll say, the hair looks brown, without coconut oil.
Correct.
It's because that you are having to work outdoors, which means that you are not economically the same as somebody indoors. And B, you're also having to, you cannot afford a grooming agent. So it was cultural, socio-economic, and that was the most commonly available product. Now that said, does it have hydrating properties? It probably does. But today, with so much changed in our exposome, AC environment, and we want a certain appearance, we want to look a particular way, you want that to go with your outfit. For all of these, coconut oil is no longer the best product for who you want to be. So there we use, and then science has, the material science has just evolved. It's an explosion of discoveries over there. And we have more elegant products that can still make the hair look groomed. And much better than coconut oil and non-comedogenic.
Coconut oil applying on the skin, that's also not.
You could.
You could.
There are better options.
If somebody looks at this product is hypoallergenic, dermatologically tested, all this or like red flags to stay away from, or is it okay to buy?
No, not really. So if something is hypoallergenic, it means there are some products, like we said, which are notorious to cause an allergy. Like for example, para-phenylenediamine, we know that yes, there is a certain amount of allergy possible. Para-toluidine-diamine used to be considered safe comparatively, but this year they have declared it as the allergen of the year. So then these are products we know that they won't come under hypoallergenic. Other products, like you said, hyaluronic acid will typically come under, okay, these are hypoallergenic because they're not known to cause allergies. So that's what it means by saying, hypoallergenic. The West has different grading methodologies. For us, it simply means that they have made the product potentially with ingredients without allergens. The other thing you asked was about dermatologically tested. This is usually like a standard test process that is being done. It is both done at third-party CROs, clinical research organizations, or it can also be done at affiliated centers to many medical colleges test products. So it could actually be tested by dermatologists. So that's a protocol, and they give a certification for that typically. Yeah.
In gastroenterology, if you look into a probiotic supplement, they say 1 billion of bifidobacterium is here. If you actually look at it, there will be two problems. One is it will not be million, it will be like 500 million or something. Second is it will not be bifidobacterium.
Bacteria.
It could be something else. Is that a common thing in skincare?
There are lots of grades. So the common thing is what we call as a percentage wars. For example, if I were to ask you, let me give you cream A or a serum A, which contains about 10% of vitamin C. I'll give you serum B, which contains 30%. What do you want? Price is the same. What do you want?
30%.
Yeah.
I will ask if you have 50%.
So, but what happens is, at around 15 to 17%, vitamin C loses its ability to do better. 15% may be better than 10%, but 15% is still better than 30% because vitamin C typically has the ability to become a pro-oxidant. So, what happens is that the percentages are to be understood in the context of the individual ingredient. Zinc, even a recent podcast by Huberman, I think he said it should be used up to 25%. That was a guideline when I was in residency. But what happened after that is, when you keep on increasing zinc, it causes an irritant reaction, which is difficult for people to have continued compliance, and you really want people to use sunscreen because that's how it works. So what happens is 5%, 6%, 7%. By the time you reach 10, 15, 20, depending upon what grade, there are hundreds of grades and hundreds of ways in which these can be made into a product. As you move to, you can see that as you move, there is a sweet spot where the irritation is less, but the SPF maxes out. Then you iterate to that space and stay within that particular space. So then this can never be made equal. There are innumerable materials.
But as a common man, how will I know that, okay, so this company is in this nice blended way? Is there any, for example,
indication? No, I see that, from in the last 5 years, considering the proliferation of skincare companies, I do feel that there is very little there's very little regulation that can actually make people understand that this is good or this is not good, because right now that whole percentage was what was playing up so far, and currently what we are trying to do is to be able to put out as much information as is scientifically feasible. So when somebody says like, why don't you have a 25%? No, you will not be able to tolerate it given your geographical conditions. And our sebum is something that is an anti-aging factor for us also. So we need to be able to know what you will look like or what your skin will be like 10 years down the line. So you need to protect and also do something in the present. So these are concepts I think the industry will mature a little bit. I think that happened with your industry where everything on the package was wrong.
Right,
Some things in the package are getting better. Now you will add your push to the education part to say like, this is okay.
Correct.
And these are not okay. For us, it's still work in progress. Many dermatologists are understanding this much more these days as compared to earlier, because it was not, we were dealing with diseases. We weren't dealing with well skin. Now we are. Yeah.
You talked about my field. So I know now that, okay, fiber content is high, protein is high, carb is, on an average. It's a good product. Do you have something like that on a skincare thing?
Because of the number of, fiber is a category, because of the number of ingredients that we have.
Let me ask you your favorite sunscreen.
Yes.
In sunscreen, what should we look at?
All right. I think I wasn't getting the question earlier. Now I get it, right. Zinc sunscreens are the go-to. That should be the most commonly used.
Any percentage of zinc?
There's no percentage. You look at the SPF factor and you look at the PA factor. There's SPF should be at least 30-40. That's good enough because SPF protects against UVB, more for skin cancer prevention than really pigmentation. UVA is one of the key factors for pigmentation. So that's measured by something called PA factor. You need
factor.
PA and you need to see the number of pluses after it. 1, 2, 3, 4. 4 plus is good.
I see.
And then you look at something called critical wavelength. Usually the number will be 370 nanometers plus. What it means is that it is able to protect into the visible light spectrum. Because unfortunately for dermatology, visible light, like the light, is the most important cause of pigmentation when it comes to conditions like melasma. I wouldn't call it the most important. UV also contributes, visible light also contributes, and unfortunately further, infrared, like you stand next to the flame when you're cooking, that also contributes to pigmentation. So we have ingredients in sunscreen, antioxidants, typically pycnogenol or polypodium or astaxanthin that can extend the spectrum of the sunscreen into infrared, up to infrared. So you need to look for something that's called a broad spectrum sunscreen over and above high SPF alone.
For a long time, I was just looking for high SPF. SPF 80 doesn't mean that it is better than SPF 30?
SPF 80 is more likely to stay durable on your skin compared to SPF 30. They have earlier we used to be given the advice that you have to use it every 2 to 3 hours once. There is enough data and personally have worked with sunscreens. We've immersion tested for 8 hours plus, and we've also done UV camera studies. We see the sunscreen hanging around well up to 8 hours, and a number of body of studies have been done which show that a 50 SPF sunscreen at best, even with outdoor working, even with toweling, swimming, came down to 30 SPF. So because we want 30 SPF, a 50 SPF for 8 hours is still valid. So that is there. But that doesn't answer why we are using sunscreen. We are not using it for skin cancer prevention. There's very minimal skin cancer for us. Even there's a condition, the melanoma that we have, it's called acral lentiginous melanoma, comes on the palms and soles, which are not even sun exposure related.
The skin cancer in South Indian or Indian community?
South India is very minimal. We mostly have non-melanomas to a certain extent. Melanoma skin cancer is quite low. They have it a little bit in the northeast, the arsenic belt. And we may have some.
You're saying that the skin cancer incidence itself
is
lower in
very,
South
very, very
Indians, maybe slightly higher in the northeast.
Yeah, maybe. Yeah, in overall India, because the data is usually for country-wise data. Country-wise, we get the WHO country-wise data, so then that's like super low. But even here, the South Indian data seems to be like even lower compared to and melanoma skin cancer, particularly that kind that we get, happens on sun-protected parts.
On the palms, which is not exposed by the sun.
Yeah, that's quite different.
Quite different.
We are a completely different race altogether.
So the sunscreen in our race is not for prevention of cancer much. It's only to prevent the tanning and pigmentation.
Tanning is everybody tans. That much we can accept to a certain extent. People who do not like tanning, I generally say, okay, you can use a sunscreen because it's going to protect you. That's about it. But we are all going to age with pigmentation. So then for photo aging is definitely guaranteed by sun exposure, light exposure. So that's why we say, you really need to wear a sunscreen. Pigmentation is like 60-70% chances for us. Melasma, what we call as maturational pigmentation. My biggest worry is the hair color induced, cosmetic induced pigmentation, because all of us are using more products. And then it seems to be coming up much more commonly, and especially when our parents are using hair color. The generation that does not understand hair color, but we put them on it or something like that. They need to be put on sunscreens because you can definitely see that there is a photo component.
So when you say pigmentation, it's basically pigmentation of the face that will make them age faster?
No, we differentiate photo aging and pigmentation conditions. Like example is melasma, or example is when you have a hair dye allergy and the hair dye allergy that you actually see that can be very distressing is somewhere where the person becomes completely black to grey. I'm not talking about like a light tan. I'm not talking about that. That is easy to manage.
Oh my God.
Because in this kind of pigmentation, the quality of life takes a beating and the success rate is not 100%. We struggle with everything in the armamentarium to get it, to come down by 30%, 40%, 50%. So when this kind of pigmentation happens, we fail so many times. I really want to prevent that.
So you're telling me that people who are using multiple hair color, hair product, everything?
Hair color, room freshener sprays, people, even essential oils can be. We reported a case of beard growth product causing lichen planus pigmentosus, much beyond the area of application.
Oh my God.
And that we had to put immunosuppressives.
So you're saying people who are using all these products must use sunscreen
Definitely.
to prevent the pigmentation problem related to the product.
Possibly. Or you use very good products which do not have a lot of
A lot
sensitizers.
of sensitizers. So summarizing what you said for sunscreen, so I'm going to look for like 50, 80 SPF so that it lasts for like 8 hours.
40, yeah. That's 50 plus is good enough.
50
40
plus.
plus, 50 plus is good enough.
It's good enough.
It'll come down to 30 at the end of the day. So it's still okay.
End of the day. And then I'm going to look for something with zinc.
Yes.
And then I'm going to look for the PA factor.
Yes.
When there'll be a plus sign.
Yeah, 4 pluses is good.
4 pluses is good. And then fourth thing is...
You look for a critical wavelength number in that.
Yes, you told me
More
that.
than 370 nanometers is a good thing. The closer you go to 380 plus, 390 is difficult. 380 plus is actually quite good. And you look for antioxidants and you look for visible light protection. It'll be mentioned there that this protects against visible light. So those are the features to really look for.
Visible light is even this light. Huh? Not the sunlight. Not only the sunlight.
But now this is like an exposome that actually puts in a lot of light, but there's also now infrared is low because this is keeping us cool. So we'll get away with some part of it. But humidity is less, which means we need to hydrate. We need to drink water.
So as a dermatologist, how often you apply sunscreen to yourself?
I'm only doing once.
Once.
I always have done once. So during COVID, we had a survey of close to some 10,000 people, and they said that we are not able to apply more than once. And that's one of the things that triggered us to look for
Long
wear
I
sunscreens.
see.
Yeah.
As soon as you wake up, you are...
No. I before I leave to work,
Before you leave to work. Okay.
and then characteristically there'll also be a little bit of makeup. And then if you ask anybody who's applied kajal and then to apply sunscreen over, we'll end up looking like raccoons. None of us will. Maximum we will do sunscreen retouch here. So I just use once.
It's not only for women, men as well. For sunscreen.
Men, of course, if you okay, maybe because you're not looking at men closely, I think we get away with that. But for us, it becomes that much more obvious because we are also doing other stuff.
No, I'm saying like sunscreen is recommended for,
Of course, for
sunscreen
everybody.
is recommended for men as well.
Of course. Yes.
Not only for women.
Not only for women. for sure. Nobody gets left behind. No, we recently had a survey again of chosen as a community. So then we end up asking questions there. And the most important pain point was the visibility on the beard. The visibility of the sunscreen on the beard. So the blendability was a factor that we worked on in one of the SKUs. So,
Wow.
so I think different for us, it could be a difficulty in applying makeup. For men, the problem could be that it shows up on the beard and stuff. So, yeah.
So, Renita, in my field, because I came to social media, I get a lot of requests is that, okay, so can you review this product and let me know this is good and everything, right? So, before I used to get a product, now I'm getting a reel. Right? They're sending it that, like applying turmeric on your belly will decrease your belly fat in 7 hours.
That is real?
I hope it is not. You will be seeing so much amount of skincare reels, right? I think more than gut care, I think skincare is the topmost thing in social media.
Yeah.
Have you ever wondered, some influencers are doing it without their knowledge. For example, let's say we talked about paraben and phthalates. They used it, they look good. The influencer think that, okay, so this is a product that I used, I looked good, so I am recommending to my clients, right? If that product has phthalates or paraben, that person might not know if they don't have any medical background.
Yes.
What do you think will be the impact of all this on our patient population?
I think one group is fairly good. They put out good stuff, good content, even if they aren't truly medical. There are people that have worked over a period of time to understand. Unfortunately, that's a minority. And then you have like a bunch of people who just want to convey what's in the brief that's given to them. Two trends which are really dangerous that are going around right now is the sunscreen application on the scalp. I don't know if you've come across. It comes across every summer. It keeps happening. And also sunscreens causing cancer will also... I just did a reaction video also on that. It keeps coming up every summer. Same things. Exact same reel will come every summer. So I will do the exact same reel every summer. So the sunscreens application on the scalp is kind of trending right now. Now, where does this come from? For the Westerners, where they have a history of skin cancer, the directive in the Dermatology Academy page goes that do not forget your scalp. Make sure to wear a hat. The first thing is a physical protection. Physical protection is unbeatable. I recommend sunscreens only for places which can't be covered by clothing. I'm not a fan of body sunscreens except when you're out on holiday in a bikini. Outside of that, for everyday commuting and all, or just cover up. Yeah. So then this application is basically from the point of view of people who have a risk of cancer on the scalp, because that is also one of the areas. Now, if you want to apply it to our context where we actually have hair, and then you're trying to apply it in the on the partition lines for God knows what. Sunscreen chemicals have been associated with inflammatory reaction in the hair follicle and can cause hair loss, especially the older sunscreen chemicals.
Oh my God.
And also they're using nano-titanium. Right?
What is with nano-titanium?
The smaller the particle, the more reactive it is. And nano-titanium has been picked up from hair follicles and can cause destruction also.
I see.
You really want to avoid it, but you're actually promoting something that's completely counter. Now that is dangerous for me. Because what will happen is people will start having reactions and they will start dissing all sunscreens. It's not white or black.
Correct.
So that is one aspect. The second group is people who think that everything natural is therefore harmless. There's enough data about natural remedies. Unfortunately, our beloved turmeric is also a photosensitizer.
Is turmeric bad for your skin?
Yes. You can eat it up. It's good for your skin. But application, it's a photosensitizer.
What is photosensitizer?
So there are, like our hair color, like the agent in our hair color, when you have an agent that can interact with the sun to create a reaction in the skin, we call it a photosensitizer. Right? Henna, people think that, commercial hair dye is dangerous. So they pick up leaves. Henna is a photosensitizer. Henna extract is used in long-lasting tan products in the West.
But what does photosensitizer do to the body? Increase pigmentation?
Pigmentation. Photoallergy, less common, but can cause
I've seen
pigmentation.
people applying turmeric on their face a lot.
A lot. It went away. Luckily, it went away.
I see.
Now we see the henna is the biggest natural problem. But it's also that the thing about medicine is we will never take a dictum saying like do this and therefore now. That unfortunately I think it's a Dunning-Kruger effect.
Yes.
Unfortunately for that we will never say things like 100% henna can cause problems. But because we see patients coming with it, we are like, better to stay away. Can you say for sure that it will cause problems
Probably
in me?
not.
I don't know. Maybe the exposome data will tell us over a period of time.
But the risk is higher.
Yeah, because you have pigmentation, why don't you just stay away from henna? So everything natural is it. Immediately you will be like, it is anti-cultural, anti-national. It's not with the,
You're anti-Indian.
all of that. Because you're saying things that are not.
But you have seen from your experience that increase. What is your take on aloe vera gel?
It is a good ingredient, but, for lack of, what do I think about water?
You could have chosen a better example. Water. So,
what? Okay.
no, what I'm saying is water doesn't do anything to you, right?
You mean you drink it hydrates you.
No, on your skin.
On your skin, yeah, you do.
Hydrates.
If you use, yeah, of course, it can increase hydration, especially for children with atopy. We ask them to have a long bath.
So you're saying that aloe vera gel almost is the equal efficacy of water?
It moisturizes maybe a
little tiny bit more than water.
Yeah, because it also dries on the skin after a point in time. So it's or if you think, what about what else can we? One famous cosmetic chemist said that even if you were to take out your floppy disk, powder it and apply it on your skin and call it a moisturizer, it's a danger of being called a moisturizer. So anything can
be considered a moisturizer.
Anything can we call that hope in a bottle also. Hope in a bottle. You
hope in a bottle.
Yeah.
I see. Hope in a bottle. Wow.
You really need to. There are many claims for many things. They need to have an evidence base.
Okay.
Short of that, it's just a claim. So if the aloe vera gel is housed in a biocompatible formula which can stay on the skin and shows significant hydration, then I'm for it.
So I have my aloe vera gel on the shelf. What should I do with that?
No. It's like if you feel hydrated, you can use it. The proof is that how you feel about it after.
It can dehydrate you as well after a while.
It depends upon the formulation. Sometimes they add a lot of some of those are very perfumed. They add a lot of fragrance to it. Some of them have a little bit of a cooling, drying. They add menthol to aloe vera. It's a very common combination. Menthol is an irritant. So I wouldn't diss aloe vera completely. It's probably very useful,
But not to the extent that what we think.
it's a base. Many formulations will have an aloe vera juice as the base. It's a nice base. We use, sometimes you see aqua as the first ingredient, sometimes you will see aloe vera as the first ingredient. So it's like it's a nice base. No, nothing taken away. I meant the water comparison like that. Sorry if I hurt you.
How about lemon, baking soda?
Not at all.
Not at all.
They're all irritants. We were talking about sensitizers where there is an allergy component. These are all plain irritants. Like, for example, if people put toothpaste on their pimple, it burns. And people put crushed garlic on their acne, crushed garlic, it burns. So those are all straightforward irritants, not to be had.
Straightforward, no. And I'm going to show you some videos and then wanted to have your take on it.
Okay.
Okay. So the first one. So the guy is filled with acne. And this is a simple quick fix for acne. Is this true? Yes or no?
So, for example, you've woken up or you've come out from a
Coma?
Let's say you've come out from a game. Yeah, coma is difficult. How I wish that happens. So you come back from a game of playing football. School day, you would have done it. Sports day, you came back.
Correct.
You were tanned, and then there was a lot of gunk, and then you washed. You see an effect that much. For example, getting rid of acne, not having occlusion overnight with an application happens when we treat patients for chemical peels. You'll see that there is an improvement. But something like this, I will call this a gimmick. Nothing more than that, because you also have a certain buildup of sebum that's washed off, right? Hydration, water. To give an example of water, if I were to take a hydration test now, and then if I were to wash my hands and take it, it'll show 300% more.
Correct. Yes.
It happens.
So the next one is my
Viva.
favorite actress.
And we're going to do a DIY little secret
My
recipe.
favorite actress.
A flour, whole wheat.
She's a great actress.
She better be right.
Chop turmeric into it. So you take some lime, and then we add yogurt to it.
Is it your department or my
Turn it
department?
into a paste. Paste to put in the rose water,
Yogurt is good.
and that'll.
To read this.
This is updone. And that's like the
This is
consistency.
Bajima.
And in about 15-20 minutes, it becomes like a mask. It rub it a bit as it is drying to remove it. So when it
I was thinking that this was what she.
Puts in her products? I hope not.
No, I thought this is what she did for Baljirao Mastani. What do you think? If somebody does like this, Priyanka Chopra.
No, I think the Bajirao Mastani is good. That's good. No,
So
I wouldn't buy anything like this at all. The reason is that when you apply something on the skin and you wash it off, the washing effect itself gives you a lot of clarity of the skin. That's why we like, everybody says, I wash my face, I feel clear, but over the day I become dull. That's how the skin is. It will start secreting sebum when we start looking dull over the day. I do not think
Those
that
added ingredients doesn't make a big difference.
these are not the ingredients we want to make a difference. Suppose you used something like a tranexamic acid overnight, and then you saw the next day or then the week, you'll see erythema going down.
I see.
That is an effect.
Redness going down.
Redness going down, yes. Especially, we have this common problem called topical steroid damaged face. People want skin lightening, and you have n number of YouTube videos that talk about how you can use a steroid cream for skin lightening.
So steroid cream is not good for your face. For skin lightening.
It's a prescribed product for maybe like a particular eczema or a psoriasis or anything like that. It's been given for that. And then people see how it lightens the skin, and then they continue using it for years together, especially when they're using it for more than 3-4 months. It starts giving you the steroid damaged face. And then and that's a unique problem. Westerners won't understand this. They don't see things like this. For skin lightening,
I see.
it's our unique Indian problem. So then something like tranexamic acid can reduce the redness that comes from it in a matter of, say, few days to few weeks. That's so life changing.
I see.
That is something I would agree with. Yeah.
All right. We'll send a message to Priyanka. All right. This is Janvi Kapoor.
Skincare routine is I make it a point to have a shower every time I feel like I'm getting a little sweaty or icky. I need to have like a hot shower. I feel like it really opens up my pores. Yeah, I only
cleanses
use
you.
like natural products like milk, honey, malai, yogurt, fruits, and before sleeping I mix
She eats it or she mixes?
rose water and glycerine, and I put it on my skin.
All of this was on the skin? Oh, yogurt is so good for the gut and the skin. But I thought she said have more of all of this. No?
No, she's mixing it, everything, and then putting it on the skin.
So now, if all of that went in, and if the skin was that porous and all of that went in, when we go into the swimming pool, won't we become sponges and everything goes in?
So it limits, skin
There-
limits the absorption.
These are macromolecules that you really can't send in. There has to be a certain size in the formulation. Even hyaluronic acid, we say it's like sending tennis ball across a number of golf fields. It needs to go that far.
Go that deep.
That deep. Yeah.
Next is
I don't really have bad skin because I drink a lot of water. I avoid sugar as much as I can. I mean, after a certain age, I completely stopped drinking alcohol, and yeah, so I think I'm pretty fine. I eat a lot of greens, green juices.
Plus a very strong genetic background.
genetic
Of
background.
course.
Huh.
The genetic jackpot.
Do you think if genetics is bigger or the lifestyle factor is bigger?
Genetics used to be the thing because we only knew about genetics, but right now, considering that I do not know which is bigger for as an overall concept, but for specific, let's take hair for example. Strong genetics.
Genetics.
Like you could have a friend that smokes like the chimney, stays up late, and have zero hair fall, and this person who'd be living like a saint will have hair fall. It's just not fair. I understand, but
For the skin?
for the skin, I think
It's not that much.
Not that much, especially.
Lifestyle can equate.
Lifestyle has a lot of. We have agency when it comes to lifestyle. The genetics can't go back and change parents. Here we have agency to really do something about it. Yeah.
So what Sonam is saying is pretty good.
Sonam is on point.
What she has on point. Now this is
स्किन
Shilpa
केयर हेयर केयर ये सब अंदर से खुश रहो सब कुछ सही होगा आप यू हैव टू थिंक गुड यू हैव टू फील गुड एंड यू हैव टू ईट गुड ओनली देन विल इट रिफ्लेक्ट आउटसाइड एंड दैट्स माई एडवाइस टू एवरीवन एक दो चीज़ों की बात नहीं है इट्स लाइफस्टाइल choices that I make. I drink lots of water so my skin looks good and I have the right vitamins, vitamin E, vitamin A, omegas, so then my hair is good.
I think few of the points were nice. What you eat will increase your gut skin axis, and then that will
How you sleep
Sleep.
is also huge.
huge.
So I agree, but yes, there's also the way that you know how to dress, and also to be able to use the right makeup products, how you project yourself, and how you have the best access to all of these, the best diet, the best trainer. It makes a difference.
It makes a difference.
Of course.
How about the omega-3 that she was talking about? Is any role in skin?
Yeah, generally I think that those are things that you can actually take quite a bit from food. So I generally go for supplements that can't be matched in food, but whatever is possible in diet, then take it preferably from diet.
What is the one supplement that you would use on your patients frequently?
I typically ask them to go in for a good a diet that's rich in collagen. I use collagen supplements and antioxidant. It would be typically pycnogenol. I also like astaxanthin. But why all of these is that over the years, especially post-procedure, when we're looking at a faster healing, I feel that anything with good protein and of which collagen is a component is excellent. Earlier, I used to write prescriptions out for fish soup, bone broth.
Bone broth, yeah.
I used to write out the prescriptions. Back then, 10 years ago, we didn't have collagen supplements. And the first collagen supplements started coming in somewhere. I started using them first in 2015-ish. But then they used to be the liquid shots, which have a lot of preservatives. Then the powder forms came in. So when I had the opportunity to do our own R&D, that was the first place that I felt like, okay, should kind of make sure that this is preservative free. So that is something that we constantly recommend. But even in those cases, if you can manage it in diet.
Diet, yeah, yeah.
If you can have a bone broth regularly, you don't need supplements also.
Bone broth, the key thing is to simmer it over 8 to 12 hours.
Yeah.
That's the
And-
key.
yeah,
That is how all these fatty acids are being released.
Yeah. Even for fish, they have to do it for that long. I tell that I ask them to use that matti soup, matti fish, which kind of dissolves in like 2 hours.
2 hours.
Completely dissolves,
This-
right?
I'm talking about the chicken.
Chicken stock, the
lamb,
bone broth and
bone
stuff.
broth
Yeah,
is- The simmering
Has to be done.
increases the efficiency.
Has to be done, for sure,
Increases
for sure.
efficiency.
Because we cut away all of those when we buy fish. We remove the skin.
Correct.
If it is the chicken, we remove all the parts that are rich in collagen. Unless you're eating something from beak to tail, even if you're taking meat, it's not all collagen.
Collagen, yeah. So, from a normal person, is there a role for collagen supplement to lighten?
For everybody, if they can have it in diet, nothing like it. For those of us who can't, I would recommend a supplement.
For
But this-
what purpose? Like lightening of the skin or glowing skin?
Collagen decrease is associated with many skin aging features. Like
Anti-aging feature. I
anti-aging.
see.
And also, health of the top layer, the epidermis, comes from the health of the next layer, the dermis. It's inside out. If the dermis is happy, then the epidermis is also reasonably happy. So for dermis, the most important part of the dermis is collagen.
Collagen.
So you get that collagen integrity, and collagen behaves like a rogue if it is the if it's the broken down collagen. Broken down collagen stimulates more breakdown of collagen. So you really want to have mostly good collagen, and because now studies have come in that show that there is a change in collagen quality and collagen quantity in the dermis. So I think we have enough data at this point.
You keep saying you're mid-40, but you look like 35. Okay, you look much younger than your age.
Bit of work done.
Is that, I know you're worked out, your dietary supplements, everything, dietary intake is pretty good, I know. How about collagen? Is there collagen a part of you?
I'm also grateful to genetics. The South Indian gene, I think we all age less. Even our parties won't look that easily wrinkled, right? They don't have that hollowing that Caucasians have, unfortunately. They don't have that fine lines and wrinkles. So second thing is Chennai. If I were in a less humid place, the skin would not be as comfortable. My problem is pigmentation. I've had pigmentation ever since school, college.
Tell me, what is in Chennai helping you?
Humidity.
Humidity. Humidity is helping you.
Yeah.
In what
Our barrier repair happens naturally with the humidity.
Higher humidity, better the barrier repair.
Yes. You see more of dryness, especially more of skin dehydration, typically when the humidity is way lesser.
You know, in Sacramento where I live, the winter months are much colder and humidity is very low, and that's where your dryness of the skin flaring up is up. So you're saying
Even when it's not hot. So the pigmentation part. So I probably had pigmentation from a very early age. I was diagnosed with endometriosis in medical college. So I've been on hormones for most of my life. So my way to age will be with pigmentation. I already have. I mean, I'm at a high risk because I've been on hormones for a very, very long period of time. So for me, the most important thing has been sunscreen use from a very early age. Luckily, it happened when we were in residency. So that is one area that has really helped the skin behave itself.
I see. Nice. Any take on how do we get this Korean glass skin?
Filter.
Filter? Instagram filter?
Instagram
Or
filter.
coffee
No,
filter? No, just...
So, when I was in Korea a while ago, like pre-COVID, I really wanted to look at the people on the street and say, do they have the glass skin? They didn't.
They did not.
Of course, if you visited Korea, you typically know that they look like us, not like what they look in the soaps. So, for that effect, you typically need a high moisturizing. You need a high gloss moisturizer. You need something that's a little bit on the oilier or a little bit on the something with more reflectance, and then you need a moisturizing makeup base or moisturizing sunscreen. I would be very interested to see if the Korean glass skin remains the Korean glass skin minus all the layers that they apply. I'd like to see how the skin is natively, and I don't think that's any different from South Indian skin. They are much lighter, of course. Their melanin content in the skin is much lower. Outside of that, in terms of quality and in terms of skin reflectance, I don't think there is a lot of difference. In fact, people with more reflectance would be people with African ancestry. Their skin shines. I would typically, I used to work as a medical volunteer, Doctors Without Borders in Africa.
Is that right?
A long while ago.
Oh, nice.
And I used to think that, everybody, regardless of socioeconomic status, the skin would literally glow in the equatorial sun.
Why is that? Genetics.
Yeah.
So you were saying that African skin is much shinier than
Yeah,
Korean
yeah,
skin.
yeah.
I think it's the first time that I've heard that. But I think maybe their physical activity and
No, I think it's the melanin content, the high melanin content. They also have more sebum secretion at some level. So the higher melanin content is typically the sun calls to the melanin. On sun exposure, your melanin goes on top to protect your nucleus. So it's something like a natural phenomenon that happens. It's like we have inbuilt sun umbrellas inside the skin.
I mean, in medical school, that's what they say, right?
Yeah.
Melanin, the higher the melanin is, the
Inverse
decrease the risk of
skin
any kind of
cancer.
skin condition,
Yeah.
including skin cancer.
We are at very high risk of pigmentation.
Pigmentation.
Yeah. The more pigment, our injury response is pigmentation. So then we end up having pigmentation. But skin irritation wise and all, we've got like a literal geographical jackpot of stuff. Especially towards the coast, we have good humidity. Dandruff is lesser compared to places with lesser humidity. So overall, I think we are quite okay. Maybe our habits in terms of how we care. Typically, we care very little for the skin. So if we care for ourselves a little bit, I think
more?
we've been blessed in terms of the general exposure.
Wow. If let's say a 25-year-old female watching this episode wants to get to the Korean glass skin, so now genetics has been taken out of the equation. Can she do with all these protocols to get that?
The 10-step Korean routine is a waste of time.
Waste of time.
Studies have shown that higher the number of ingredients, the higher the amount of sensitization. Recently, we published something saying that the more number of ingredients in a sunscreen, which is typical for Korean sunscreens, the higher the allergen exposure. So you really want to do it as minimally as possible because there's enough data to say that. So where do the people that come in who say all skincare is bad? Where are they speaking from? What is their viewpoint? It's because they're looking at studies and points where they say use skincare, more risk of cancer. And that's because those studies have people
Melanin
that
is low.
used a lot of stuff, or if they have not been protected enough, and then they try to extrapolate it. And Korean skin, where they say 10 steps, is absolutely wasteful. The sheet mask is the most wasteful, ecologically useless thing there is.
So you were saying sheet mask is not helpful.
What for? You want to apply a product, just apply it. Why do you load it onto a sheet mask?
What are you talking about?
Why
There
do
are
you
10
have
sheet masks my wife has right now.
We'll talk to her on the way out.
At least to her, she says it's okay, for my So you're saying sheet mask is not helpful?
So what are you achieving with the sheet mask? You're basically achieving a level of occlusion. You basically put the product and you're achieving a level of occlusion. But by loading it onto the sheet mask, so what do I have to do? I have to put more product, right? And I have to make an outer plastic lined container the outer container for that particular one sheet mask. And I have to put lot of product because I have to make sure it is succulent till it reaches you. So I'm loading 2x the product. Then by the time it comes to you, because I have to make it succulent, I have to put a lot of water in the product, which means I'll have to up the preservative, right? Then I bring all of that to you and you're applying it all over when you could be taking it out of the bottle and applying it and using an occlusive, a reusable occlusive agent on top, right? For example. So you will apply all of that. Now it'll have cut out areas for the
Correct.
Now
Face
the
and
T-zone
mouth.
is oily. The rest of the face is not oily. So but then you will be layering everything and some of it goes into the eyes. And then you take that thing and throw it away. So you've thrown the outer sachet, that, and you have also thrown this. And if you do this, you have 2-3 sheet masks in some protocols. All of this is not even biodegradable. There's enough for all of us to enjoy skincare, but this is absolutely wasteful. This and the small silicone single-use pads. This is difficult. This is difficult for all of us. All of us putting out so much is difficult.
Wow. I'm going to give you a number to my wife, okay? Please help me out. I'm going to ask you a very common question, okay? So, what is the one most common skincare mistake that you wish the patient didn't do?
Relying only on applications and not understanding that a lot of it is about your lifestyle.
Diet or exercise?
Sleep, diet, exercise, then skincare. In that order.
Delaying the sleep for an hour for the skincare routine compared to sleeping on time.
That is a very good point to tackle, actually. Like, by the time you do 10 steps, yeah.
As a dermatologist, delaying the sleep time for the 1 hour extra skincare routine versus sleeping on time to get the 7 hours of sleep. What do you take?
100% sleeping on time.
Sleeping on time.
Yeah.
That gives you more.
Of course, the whole reset, the cortisol melatonin reset is so important. Insulin resistance is so important. There are multiple mechanisms that actually get triggered when you get enough sleep and also sleeping on time. Earlier it used to be that X number of hours, but it's also about sleeping with the circadian rhythm. So then it makes a huge difference if these small, and these are all compounding effects.
Correct.
They don't
Cumulative.
work today, tomorrow, but then they make such a big difference overall.
Don't you think it's a very common problem?
It's extremely common. I think I have this pet saying where I say if nature really wanted us to work at night, should have left the sun on. So, but I think it's become, career is also equally important.
I think we only have a little bit of time left. And in that time, the skincare routine has become a part of a career-oriented thing as well.
Of course.
But I think the education and reassurance is that, sleep is much more than your night care routine.
Yeah.
Maybe they will come and then start the night care routine 1 hour earlier by your sleep time.
No, you really do. When I meant career, I meant like people staying awake. Not so much for skincare related career. I meant like,
what I'm saying is actually presenting yourself.
yeah.
So another common question I used to get is that, okay, so I am a corporate employee. I go to the office at like 9 a.m. I come back around 6 p.m. What should be the common skincare routine for me?
Because you are a corporate employee, I assume that your office will have some level of air conditioning.
Correct.
So you will need a moisturizer. Ideally, moisturizers work best at bedtime or in the evening. So you could moisturize the previous night, and the next day morning you will typically need a sunscreen for your commute, and also because you'll be in front of systems for a very long period of time. That should be it. That's enough. Use a good cleanser, and that's about it. Maybe if you have problem skin, then maybe you add a serum accordingly. But otherwise, this is more than enough.
Tell me about the cleanser. When should we use that?
Twice to thrice a day. Morning when you wake up, evening when you get back from office, because pollution-related pigmentation is one big domain in our field right now. So when you come home, wash it off. And maybe I typically recommend once again at bedtime before you apply the moisturizer for the night. That's mostly enough. If you want to add more, depending upon the age and stage of your skin, then you can add
Super.
actives.
Beautiful. You recommend, I know how to buy a sunscreen now, based on what you told me. How to buy a moisturizer? What are the ingredients I should look for?
In a sunscreen, we want certain things. In a moisturizer, we don't want certain things. For example, we don't want this phthalates, we don't want this parabens. We look for clean ingredients. But if you have acne-prone skin, you'll use a water-based light moisturizer. I like a lot of methyl sulfonyl which is almost, which is very skin-friendly, which is very skin softening. So I like that. You can also have hyaluronic acid. I also like EGF. The peptides. Any of these is fine. Sometimes if you just have a moisture, for babies we make a bland moisturizer. That's just about barrier repairing agents.
Nice.
That's more than enough.
Nice.
Yeah.
You look like you're very passionate about this. You are working on something right?
Yeah. For me, that EDC free, endocrine disruptor free product, that range, and to be able to actually do the sunscreen as a long wear, because I'm going against what I have spoken in the past, saying like you need to apply it frequently. So I want to get my facts straight, the research straight, so then it's almost come the other way. So 15 years ago, all of us were saying, 2019, the study came out about how sunscreens get absorbed even from single use. And we did a study in the clinic where we actually tested our blood for the levels of sunscreen, and we found octinoxide to be higher above threshold values. And this was when we were applying it only on
the face.
The face. That is when we really decided to say, okay, we should work in this. Otherwise, it was what chosen was only primarily going to be a marketplace of the best curated products. We never thought that we ourselves will have to go into the R&D, but that one shook us up a little.
Is it right? Yeah. Wow. I think we need people like you. Yeah, right. This is the work that we actually need.
Hopefully, I will justify justify that.
No, because we're getting busy in clinical practice, this needs to be addressed as well. Very important question. Okay, I really need to know this answer. As a dermatologist, what is your skincare routine?
I have a sunscreen in place.
You told me as soon as you leave your work, leave your home.
I wash my face. I use a gentle cleanser, or mostly I'm trying out different cleansers. So I don't have a specific cleanser that I use for a particular period. Then I wear my sunscreen. I also have a little bit of tinted sunscreen on the areas where I have melasma, because that needs extra protection.
I see.
So I have that, and of course I have an eyebrow pencil in place and a bit of kajal, and that's it. And then come back home, maybe use an exfoliator twice or thrice a week, because I want to remove all the residues off. Face wash.
Not the mask.
Definitely not the mask. And at bedtime, I'm trying out some products usually because I'm working on some project or the other. Right now, it is retinol-based product. That's about it.
So sunscreen in the morning, cleanser, moisturizer.
Moisturizer plus minus.
Plus minus.
If I feel like I work out in the evenings. 8 to 9 is my workout routine.
I
So
see.
if I worked out and I feel that the skin is moist, I also don't use air conditioning at night. in
Is it
Chennai.
right?
Yeah.
What do you mean? Oh my God.
I love humidity.
So humidity plays a major role
Yeah.
in glowing skin. Looks like what you were saying.
It does help. So when
So what do you do? Fan on both sides or something like that? Huh. So you like it that way?
I love it that way.
But many people are having the AC to like 18, 19.
No, the best. Okay, I also have a lot of pushback on this. 25 to 28 degrees Celsius is enough. 28 is what neonatology units will have. 25 to 28. That's it. Let's not do 18. Why? I don't understand. Why do we need to do 18?
The reason is, I'm going to argue in a different way. If you look into good sleep hygiene,
Okay.
so they say that cooler temperature will help you sleep better.
How cool? How much is the cooler?
67 to 70 Fahrenheit, which is around like 19 to 21.
It's almost like bears going into hibernation. That kind of temperature really messes with the skin. People wake up with dry lips. We never used to have dry lip problem in Chennai. Up until like 10 years ago, we were using lip balms mostly for, like plumping up the lip and stuff. But nowadays, we see a lot of people with dry lips. Air conditioning in software companies where they really keep it at 18 and 17 and 19. The dryness part is quite high. There's no compromise. We cannot sleep at 25-ish. No.
No, I think the solution to this is it depends upon your sleep quality. So let's say, as you say, if you can sleep at 25
Yeah.
and you have a very good sleep quality, you have the best of both worlds.
Yeah. I actually used the Whoop for a while.
You do?
Yeah. Not anymore because I used it for a while to see how good or bad it is, and I was very happy with that temperature. But I also feel like 25 to 28 is okay.
It's okay.
Maybe it's also to do with when you step out in the day. There is a very big disparity. From 25 you go all the way up to 35.
Correct.
Maybe there is a change in that. That's also something I would love to answer all of these more definitively with exposome. Maybe in the next 10 years, I hope to have the answer saying like, okay, for this person, this is what works.
Beautiful.
So then now me saying either like, do this or do that may not be the most applicable across every kind of person.
Nice.
But if we can answer these questions, because there are evidently two viewpoints, and we really have the science behind each of these viewpoints. I say neonatology unit is 28 degrees Celsius. Let's keep it 25 to 28. That's about it.
Until the 10 years, we'll keep it at 25. We'll keep it. We're coming to the last segment. Okay, it's a rapid fire. Nothing controversial. Whatever comes to your mind. Because you are dealing with celebrity, just wanted to have your angle to it.
Okay.
No names, nothing.
Okay.
Just your opinion.
Okay.
Who do you think has the best natural skin in Bollywood? First, you should know who's natural.
Yeah, and I should know Bollywood also. I would say, I think Sonam at this point.
Which South Indian actress do you think has the most flawless skin? No one is going to watch this. You're not going to get any.
I like Preeti Prabhakaran.
Preeti Prabhakaran.
She was in the movie Tangalan.
Yes.
Chocolate skin tone, rich
Is
skin
that right?
tone, such reflectance. Yeah.
Wow.
She's probably has the most flawless skin that I have seen.
Which male celebrity do you think has the best skin? It could be an actor, cricket player.
Vijay sir?
Vijay, huh? He has good skin.
Yeah.
How do you say? Based on...
Yeah, he looks good, that's it. Sorry.
Are you a Vijay fan? I'm asking from medical angle. So, which celebrity do you think glows the most without makeup?
I would say Nayan has.
Nayan.
She hardly wears much when she goes around.
Nayan. Actresses' skincare routine should be slightly different from the normal person routine.
Not really.
Not really?
Not really. It entirely depends upon what they want for the project. Because in the projects that they do, they're trying to be very relatable to you and I. So then they usually don't have to do a lot more. I think that whole lip filler, I think the whole lip filler concept and trying to look a particular way is not what most people do. It's not something that all of them end up no. And the reason that many of them are in the film industry or in the show business is because they naturally have they have an aesthetic
Correct.
which appeals to, or which relates, which feels relatable to most of us. So
nice. Good.
தீ மிதிக்கிற மாதிரி இருக்கு. In this particular segment.
It's over.
ஓடிடலாம்.
It's over. No, good, beautiful. Thank you so much for your time.
Thank you so much.
For your time. I read your book, and you have done a wonderful job on explaining us about sunscreen, and that's why we talked a lot about sunscreen. Can you show the book to our audience as well, please? She has done a wonderful job of actually writing down in terms of what is actually needed for you in terms of a sunscreen exposure, and also the utility of sunscreen as well. So similar to what we discussed in the book as well.
So the concept was that it's for sunscreens for skin of color. For the longest time we had sunscreens primarily from a POV of why sunscreens. Westerners needed it for cancer. So this is an attempt to write about why we need sunscreens. But where I really learned a lot while doing the project was also about understanding how the impact on environment needs to be balanced. Our need for looking a particular way, our need for aesthetics needs to be balanced with what the planet can take. So the bioaccumulation part, the biomagnification part, those were things that really spoke about sunscreen use. I hope there are now a lot of Indian-based researchers who are looking at sunscreens from new materials when meeting them and understanding them. So there is a lot that there are a couple of people that are getting out agricultural produce that can be used, biomass that can be used. So those are very interesting areas.
Nice, beautiful. Sounds good. I think one thing that was really striking out in your practice, and also I know you as well, that you were really trying hard to do science-backed treatment, evidence-based treatment to your patients, and skincare is the thing that they actually need. So good job on that. Thank you so much for your time. I'm hoping that you had a good time.
Thank you so much. I enjoyed myself. Thank you so much. I think the time to respond to some of the comebacks, I think I need to improve reaction time.
Next podcast.
I'll work on the gut meanwhile.
Thank you, Renita.
Thank you so
Thanks
much.
a lot.
Thank you so much.
There was a wonderful episode. I'm sure you would have enjoyed this as well. I learned a lot. So moving forward, I'm going to actually increase my temperature so that my skin doesn't get dry. Maybe find that right balance in terms of where I could sleep well and also at the same time does not dehydrate my skin. And I know how to buy a sunscreen, how to buy a moisturizer, how to look for this bad ingredients like phthalates, paraben on the ingredient list in the skincare product, and hopefully try to avoid it, and also use hair dye like once every 3 months. That was a wonderful tip that I got as well. So please share in the comment section in terms of what will you do after the podcast in terms of in your daily routine. I'll be very, very happy to see. And remember, this is a longer form of podcast released in this channel. Shorter clips of highlighted information will be released in Gut Feeling with Dr. Pal Clips channel, and even shorter 1-minute reels will be released in Gut Feeling with Dr. Pal short channel, and also the Instagram handle. Please check out the description in detail for all this information. And as usual, if you're interested in a holistic gut health program where it will improve your general overall health, including treatment for diabetes, hypertension, obesity, fatty liver, hypothyroidism, PCOS, you name it, you all know that gut health is the main thing. If you are interested to get your health to the next level, I have put together a program passionately called New Me. I want you to check that out as well. The information is in the description. As usual, one belly at a time. It is absolutely important. Stay happy, stay gutsy. May God bless you.